Okay, so this one, it happens in connective tissues called linea alba. Actually, it's the midline of your six-pack. So what happens in dissection recti is this connective tissue thins out and widen up in response to the hormonal changes. And so this tissue also being stretched and thins out to accommodate the enlarging uterus. The relaxing hormones in our body will remain up to 8 weeks after delivery. So that means the effects still acting in your body up to 8 weeks. But after that, when the relaxing hormones subsided, all your muscles, tissue should regain its strength and the elasticity. But some other don't. So maybe their linea alba is being stretched out too much that it lost its elasticity, so it become like a longkang over here. But some mummy will have bulge out instead of longkang like you're still having baby inside like that. So actually, who is at high risk of having dissection recti will be the mummies that having multiple babies, twins or triples. Definitely the size is bigger than your muscles. Second, if you have multiple pregnancy, like this your third or your fourth child. So if every time after delivery you didn't follow by a proper rehab and your muscle is being stretched and weak, yourself you don't know but the muscle is weaker and weaker every time you're pregnant, so more prone to have injury. And lastly is the mother start to exercise too early. So some mother they want to maintain in a good shape after delivery, that start too early the exercise. You sit up, plank, crunches, all these things you should not do, because when you do sit up, you are actually strengthening your six-pack. When you strengthen this six-pack, all these muscles will become tense up and shorten. So when the muscle shorten, you pull even more the linea alba apart, widening furthermore. But there are some exercises that you can perform even right after giving birth. But this exercise, you should consult a physiotherapy or some teachers that help postnatal class out there. They know what should do, what should not do. This is our normal abdomen, which you see this midline thing, that's linea alba. So in dissection recti, it's become like this. So separation of the abdominal wall, you'll see it's widened up. So there are few types, either in the middle, down, up, or all along. And there are few signs and symptoms. So the first will be if bulge or ridge that runs down the middle of the abdomen, and it's very obvious when you engage your abs. It also might lead you to have low back pain. Why is because when the separation of the abdominal wall happens, it will reduce the support in the front of the core. So you're putting more stress on your back to compensate. For sometimes your back will become pain. It's too much the stress. And because of the separation of the abdominal wall, definitely your muscle will weak. Difficulty in lifting, difficulty in performing, poor posture, constipations, bloating, and heaviness in your pelvic floor. This is the test to test whether you have dissection recti or not. If you are convenient to test, you can lie on a yoga mat or on your bed itself, lying flat with both of your knee bent. Then you place one hand above your belly button, the other hand under your head. The hands that place above your belly button should be perpendicular to the midline, the linea alba, the midline. And then perpendicular, place above your belly button. This is the starting positions So after that, you can try to sink in a little bit, sink in your fingers, and you try to feel the tensions there. You should feel the tensions that the muscle is wrapping around your fingers. Now, try to breathe in through your nose and breathe out through your mouth, while lifting up your head about 1 or 2 inches off the ground. Then try to sink your finger in even more. When you sink your finger even more, you can test how many fingers you can sink in. It's actually considered the severity of your dissection recti. How many fingers width? The positive result is you have 2 fingers and above, you consider having dissection recti. For this, we test above your belly button, but later you can try on different level like what we explained before, because there are 4 types. Test above belly button, below the sternum to test which level, see which dissection recti you have. So usually 2 fingers and above consider positive. If there is mothers that just right after deliver, you definitely will have positive result. Don't worry, it's because your hormone is still acting on your body. All the muscles and connective tissues still in very lax positions. So definitely you have positive result. So I would suggest to start test after 6 to 8 weeks. Then you will get a more correct result for you. For now, definitely you have positive. So if you found you're positive, don't worry, you can consult a doctor or the physiotherapist. They will do what they can do for you lah. They will do the needful lah. So don't worry, you can go and find a physio or find a doctor lah.